23 days. I was falling a lot. At one point, I couldn't remember how to put the window down in the car. So just a course of events that were happening. And at age 42, with two sons and a husband who I've been married to for 25 years, it was a decision that it still was hard to make. I can't lie about that. But it was a decision that I gave it a good attempt and have been very successful with.
Did your family ever ask you to quit?
No. I mean, my children, my two sons used to embarrass me in restaurants, of course, when you could smoke anywhere and everywhere. Mommy this and mommy that, you're awful and I can't stand the smoke. And I was a very selfish smoker. I smoked in the car, I smoked in my house, I smoked through both my pregnancies. I had a smoking room at Bellevue.
Wow,
and
times have changed.
Yeah, since then, the education is just so important that the word get out how deadly this is.
So education is the key. Like you gave the examples of your sons.
Mm-hmm.
I know when I work with people that have addictions, the tendency for people that aren't educated
Mm-hmm.
to take the shame-based route,
Mm-hmm.
Which is not effective at all.
No, it's not.
It closed down the line of communication.
Absolutely. Well, then they have two issues to deal with, and the education piece, it can be very brief. You give them little pieces that they can handle depending on who your audience is. But in my situation, the program that I run, or if I'm going, to, let's say, the homeless shelters that I've started working with, my audience is there because they want to be. So they're halfway there, and that's the way I talk to them and let them know that they've taken a huge step and give them credit for that, and make them feel that they're doing a really good thing for themselves first before anyone else. And then I can help them with the rest.
Let's talk about some of the health effects of smoking and the health effects and benefits of quitting.
Well, I think we all know there's multitudes of health effects. The most prominent and deadly probably are the cancers, the lung cancers, and so on. Emphysema, of course, is a biggie. And the benefits of quitting, it's never too late to quit. In the 5 years that I've been facilitating these programs, I can remember my first group, I had an 85-year-old woman come in and thinking to myself, why are you here?
Right.
Well, come to find out, she wanted to quit smoking because she was going to rehab, working on the treadmill 3 times a week, and it helped her with that. It wasn't too late for her. I've had people come to my group that are, old enough probably to be a grandparent, a young grandparent of mine, smoked 50 years. It's never too late to quit. They can still have a better quality of life.
Sure. And I was I was reading, and the benefits of quitting are almost like that. Like, for example, 20 minutes after people quit, their heart rate and blood pressure drops.
Correct.
12 hours after quitting, still in the same day, the carbon monoxide levels in the blood falls to normal.
And we use a CO monitor with our program. It's a great visual aid, and it's one of the first things they can see that has can't think of the word.
Carbon monoxide?
Yeah, sorry.
It's okay.
I
So 2
lost my
weeks to
thought.
3 months after quitting, circulation and lung functions improved. And it just goes on and on. I was amazed because, like you said, it's never too late to quit.
never
I
too
hear
late.
people, that say, well, I've smoked for 20 years, for 30 years. 9 months after they quit, the coughing and shortness of breath is reduced. Because I always hear people talk about the black stuff that they cough up. A year after quitting, your risk for coronary heart disease is reduced to half of what it was when you smoked.
And the physical things they go through, as far as when you mentioned the black stuff they cough up, I've had multitudes of people, they're very concerned, and now they're in the frantic state because this is happening. And that's where the education piece comes in. If we can start at a younger age, that the constantly, 20 drags off of a cigarette and reburning and reburning and reburning of course you're going to cough it up, you know, because you've